We often get questions about how much you can accomplish with a quote liquid facelift. Well, a liquid facelift primarily means a filler or Botox. And I don't think that the fillers and Botox are instead of facelift surgery. They're really complementary, and many times fillers and Botox can do things a facelift cannot do. So it all is a synergistic, go together type of process, and what you really need is a quarterback, your surgeon, to tell you what you need, because every patient is different. And if you compare to what your best friend had done, their anatomy and their genetics may be entirely different. So having said that, Botox is still, other than a brow lift, the best option to relax the muscles in the frown, the forehead lines, and around the eyes. In fact, there really is no other option to get rid of the active crow's feet other than Botox, because the surgical options don't work very well. Fillers are great to fill in where we lose volume, because facelifts typically tighten and lift sagging skin. They don't get rid of the volume problem we have. We have to add volume as we get older for most of us, because as we get older we lose volume and we start getting sunken, and that makes a difference when you look more youthful with the fullness. If you walk by a youthful person, your internal mind and computer just registers youthful because they're typically full. Assuming their skin is not sagging as we get older, they look older because they've lost volume. You can just look for yourself. Youthful people are full. Of course, you can't take that to the extreme, and people who just do injections just keep injecting. At some point, if the skin is loose or the jowl is loose or the skin sags, you can't expand it enough without making it look grotesquely full. So at some point the filling has to stop and you have to redrape the skin with some kind of facelift surgery. So that's why it takes someone who you trust to tell you what your options are after they hear what you want and then come up with a solution.